The following is an education learning module on influenza illness and immunization for the 2019-2020 influenza season. The objectives of the first part of the module are to recognize the symptoms of influenza disease, identify the influenza vaccines available for 2019-2020, and promote immunization to prevent influenza illness. What is influenza illness? Influenza is commonly known as the flu, is highly contagious infection of the airways caused by influenza viruses. It is often referred to as seasonal influenza because these viruses circulate annually in the winter season in the northern hemisphere. The timing and duration of influenza season varies. Outbreaks can happen as early as September, typically start in October, but most often activity peaks in January or later. Late season outbreaks occurring in April and even May have also been reported. Influenza A, B, and C are the most common types of influenza. Type A and B viruses cause seasonal epidemics. Influenza A viruses are classified into different strains or subtypes based on two proteins or antigens on the virus surface, hemagglutinin H and neuraminidase N. Examples of these are H1N1 and H3N2. Both of these are strains that have circulated and caused illness in the previous flu seasons. Influenza B viruses can be classified into two antigenically distinct lineages, Yamagata and Victoria-like viruses. Influenza A and B strains are included in each year's influenza vaccine. The vaccine does not protect against influenza C viruses. Type C viruses cause mild respiratory illness. There are small changes in influenza viruses occurring continually, and new virus strains may not be recognized by the body's existing influenza antibodies within the immune system. A person infected with a specific influenza virus strain develops antibodies against that specific strain. Most years, some or all of the virus strains in the influenza vaccine are updated to align with the changes in the circulating influenza viruses. Annual influenza immunization is recommended to protect against infection from these changing influenza viruses. Influenza illness typically begins with a sudden onset of a headache, chills and cough, followed rapidly by a fever, loss of appetite, muscle aches and fatigue, runny nose, sneezing, watery eyes, and throat irritation. Nausea and vomiting and diarrhea may also occur, especially in children. Fever may not be prominent in children under 5 years of age and adults 65 years of age and older. Complications or secondary illness caused by influenza include ear infection, viral pneumonia, secondary bacterial pneumonia, worsening of underlying conditions, and death. Influenza illness compounds complications of disease and illness in individuals with underlying medical conditions, such as asthma, chronic obstructive pulmonary disease, and diabetes. While the majority of those who become ill will recover, it is estimated that influenza causes about 12,000 hospitalizations and 3,500 deaths in Canada each year. Influenza is among the top 10 leading cause of death in Canada. Some individuals are at higher risk of developing complications from influenza, including seniors, infants and young children, adults and children with existing chronic health conditions, healthy pregnant women, Indigenous peoples, and obese persons. Flu vaccination has been shown in several studies to reduce severity of illness in people who get vaccinated but still get sick. The 2018-2019 influenza season began in PEI in mid to late October 2018, with the season declared over in mid-May 2019. This table compares the 2017-18 season with the 2018-19 season. The majority of lab-confirmed cases in 2017-18 were B strain, and 99% of the cases in 2018-19 were influenza A. There were 13 outbreaks reported. 8 of them were attributed to influenza A, none to B, and 5 were influenza-like illness. This is where there is no confirmed A or B. The 2019-2020 influenza season, the PEI Department of Health and Wellness funds a universal immunization program. All people 6 months of age and older who live, work, or go to school in PEI are eligible for vaccine at no charge. This is our third season of a universal influenza program. Each February, the World Health Organization provides recommendation on the strains of the virus to be included in the influenza vaccine for the Northern Hemisphere. 2 influenza A viruses and 2 influenza B viruses are selected based on the characteristics of the current circulating influenza virus strains. A new vaccine is reformulated each year to protect against new influenza infections. Vaccine effectiveness depends on the similarity between vaccine strains and the strains in circulation during influenza season, as well as individual factors. Influenza immunization prevents disease in 50 to 80% of healthy individuals. In the elderly, vaccine effectiveness is about half of that of healthy adults. However, influenza immunization decreases the incidence of pneumonia, hospital admission, and death in the elderly, and reduces exacerbations in persons with chronic obstructive pulmonary disease. Vaccine efficacy of 50% or lower in healthy adults has been identified during select seasons of vaccine mismatch. A vaccine that is not perfectly matched can still offer protection against related viruses, making illnesses milder and preventing complications. The 2019-2020 influenza A strains include A. brisbane, which is an H1N1-like virus, and A. kansas, which is an H3N2-like virus. Influenza B strains that are included in this year's influenza vaccine include B. colorado, which is a B. Victoria lineage, and B. Phuket, which is a B. Yamagata lineage. Trivalent vaccines cover for both A strains and one B strain, which is the B. colorado. Influenza B is typically less severe than influenza A, but depending on the strain and the underlying medical conditions can cause severe illness. The vaccine provides immunity to the hemagglutinin HA and neuraminidase NA proteins, which reduces the likelihood of infection and lessens severity of disease if infection occurs. The injected flu vaccine stimulates your body's immune system to make antibodies to attack the flu virus. Antibodies recognize and fight off germs such as viruses that have invaded your blood. If you're exposed to the flu virus after you've had the vaccine, your immune system will recognize the virus and immediately produce antibodies to fight it. Antibody response after vaccination depends on several factors. Age of the recipient. There is good evidence that flu vaccination differs in effectiveness between individuals, and this is due to a number of factors. One of them is age. People's immune system generally become less effective as they get older. Other factors include prior exposure to antigens and presence of immunocompromising conditions. It may take 10 to 14 days for your immunity to build up fully after you've had the flu vaccine. You need to have a flu vaccination every year as the antibodies that protect you from flu decline over time, and flu strains can also change from year to year. The flu is highly contagious. The virus is spread mainly from person to person when those with influenza cough or sneeze. This is droplet spread. The droplets are propelled about 3 feet through the air. People may also become infected by touching an object or a surface. that has the influenza virus on it and then touching their mouth, eyes, or nose. The virus then infects cells of the upper respiratory system, causing swelling and inflammation. It then proceeds to the trachea and lungs and enters the bloodstream, where symptoms first begin to show. People with influenza can be infectious to others from 24 hours before they display symptoms until a week after the start of the symptoms. The time period from exposure to development of symptoms is about 1 to 4 days, with an average of about 2 days. The period when an infected person is contagious depends on the age and health of the person. Adults can spread the virus 1 day before symptoms and up to 5 days after. Young children and people with weakened immune systems may be contagious for longer than a week. People infected with influenza can spread the disease to others before they know they are ill and while they are ill. Some people can be infected but have no symptoms. These individuals can spread the virus to others. This is important information for those caring for others, such as parents and all healthcare workers. In one published study, 59% of healthcare workers tested had evidence of recent influenza infection but could not recall having symptoms. How can influenza be prevented? Getting your annual flu vaccine, frequent hand hygiene, especially when ill, respiratory etiquette covering cough and sneezing, coughing into your elbow or sleeve, and staying home when you're ill. Influenza vaccine is safe and well tolerated. Remember, immunity to these HA and NA proteins contained in the vaccine may decrease your chance of getting infection, or if becoming infected, will decrease the severity of infection. Currently, there are many approved influenza vaccines in Canada and on the market. Some products are developed specifically for populations such as 65 years and older, which includes your high-dose influenza vaccine. And quadrivalent vaccine is recommended for children 6 months to 17 years of age due to the fact that it includes both B strains, which are recommended for children due to the burden of disease in this age group. The Prince Edward Island Universal Influenza Program means that vaccine is provided to all individuals living in PEI at no cost. Vaccine is available at public health nursing clinics, physician offices, and pharmacies. Individuals who live in PEI and do not possess a PEI health card can go to public health nursing clinic for their vaccine. Individuals visiting PEI can go to a pharmacy and will be required to pay an administration fee. The vaccine is an inactivated or a killed vaccine. It cannot cause influenza disease in the vaccine recipient. In addition to the antigen, the vaccine may contain trace amounts of thimerosal, which is a preservative contained in the multi-dose vials. There are trace residual amounts of egg proteins, formaldehyde, kanamycin, neomycin, and gentamicin. Check the product monograph as ingredients vary with specific inactivated influenza vaccines. There are 2 vaccines purchased for the 2019-2020 influenza season for PEI. Fluzone quadrivalent, which is a QIV vaccine, and Fluzone high dose, which is a trivalent vaccine. FluMist is not available in Canada for the 2019-2020 flu season. Fluzone QIV is an inactivated vaccine. All persons aged 6 months and older can receive the vaccine. This year, it will be available in a multi-dose vial as well as pre-filled syringes. Adult and children receive a dose of 0.5 mils, and if the recipient is under 9 years of age and it's their first time receiving vaccine, they will receive 2 doses 1 month apart. Fluzone high dose is a trivalent vaccine, which means there's 2 A strains and 1 B strain in the vaccine. It's inactivated, available for residents of long-term care and community care facilities, age 65 and older, awaiting placement for long-term care but who may be in acute care. There are 2,200 doses ordered for PEI, and it's available in a pre-filled syringe. There is some evidence that immunity may decline more quickly in older people. Fluzone high-dose vaccine contains 4 times the amount of antigen. The additional antigen is intended to create a stronger immune response, more antibody in the person getting the vaccine. The Fluzone high-dose process uses an additional concentration factor after the ultrafiltration step in order to obtain a higher HA antigen concentration. Inactivated influenza vaccine should not be administered to individuals who are less than 6 calendar months of age, have had an anaphylactic reaction to a previous dose of influenza vaccine, have a known hypersensitivity to any component of the vaccine, with the exception of an egg allergy, have been diagnosed with Guillain-Barré syndrome within 6 weeks of a previous dose of influenza vaccine. Guillain-Barré syndrome is characterized by the rapid onset of numbness, weakness, and often paralysis of the legs, arms, respiratory muscles, and face. Paralysis is ascending, meaning that it travels up the limbs from the fingers and toes towards the torso. Loss of reflexes, such as the knee jerk, are usually found. And also those who have experienced a severe oculorespiratory syndrome, or ORS, within 24 hours of receiving influenza vaccine should not be administered vaccine. ORS is the presence of bilateral red eyes plus 1 or more respiratory symptoms. These individuals should be assessed further prior to being immunized. Although this is a universal program, priority groups are encouraged to get the vaccine. Priority groups include children 6 to 59 months of age, individuals greater than 65 years, and residents of long-term care, adults and children with chronic health issues. Vaccination has been associated with lower rates of some cardiac events among people with heart disease, especially among those who have had a cardiac event in the past year. Flu vaccination also has been shown in separate studies to be associated with reduced hospitalization among people with diabetes and chronic lung disease. Others in the priority group include immunocompromised individuals, pregnant women, where vaccination has been shown to reduce the risk of flu-associated acute respiratory infection by up to 1/2. Getting vaccinated can also protect a baby after birth from flu. Mom passes antibodies on to the developing baby during her pregnancy. A number of studies have been shown that in addition to helping to protect pregnant women, a flu vaccine given during pregnancy helps protect the baby from flu infection for several months after birth, when he or she is not old enough to be vaccinated. Others in the priority group include children receiving aspirin or salicylate therapy, Indigenous peoples, and those who are morbidly obese. Priority groups also include those individuals who are capable of transmitting the virus, such as household contacts of high-risk individuals. Examples of these would be immunocompromised, such as people receiving chemotherapy, household contacts of infants less than 6 months of age, individuals who are providing regular child care to children under the age of 59 months, and healthcare providers. Immunization benefits both the healthcare provider and patient. It protects the patient. Transmission results in significant morbidity and mortality. Patients are vulnerable and often their response to immunization is not as robust. And it also reduces illness in the community. Occupational exposure is a concern given that healthcare workers are caring for the most vulnerable individuals in our population. It is their responsibility to be immunized, an essential component of standard of care, and less time lost from work. Other priority groups are identified as essential community service workers, such as police, volunteers, and firefighters, and poultry workers. Influenza illness and immunization, Part 2. The objectives for this part of the module include reviewing the protocols for administration of vaccine, responding to common questions about influenza illness and immunization, and identify reliable resources for health professionals and the public to review. The following protocols for administration will be reviewed: vaccine storage and handling, readiness for an emergency or anaphylaxis, routine practices, which include hand hygiene and safety, review of the product monograph, and the National Advisory Committee on Immunization, the NACI statement, contraindications of vaccines, informed consent, fact sheet, patient assessment, checklist, administration of vaccine site en route, observation after immunization, reporting of adverse events and follow-up, and vaccine documentation and reporting. All vaccine must be stored between 2 and 8 degrees Celsius. Vaccine should be placed in the middle of the refrigerator, not on the door. By placing it on the door, this may lead to repeated exposure to temperature fluctuations. It's not recommended to use a bar fridge due to the inconsistency of the temperature. The fridge temperature must be monitored and recorded twice a day, either by using a graph, digital thermometer, a maximum minimum thermometer, an alarm system, or manually. Cold chain breaks must be reported to the Chief Public Health Office. The form is available from the Chief Public Health Office. Do not use the vaccine. Place the vaccine off to the side in the refrigerator and ensure it is well marked. CPHO will investigate and provide direction following a cold chain break. And exposure to heat or light are cumulative and may affect the vaccine. Never use a vaccine that has been frozen. If you're transporting vaccine from one site to another, ensure that it's transported in an insulated bag with a freezer pack and a thermometer to ensure that the temperature remains consistent. Protect the vaccine with bubble wrap, newspaper, etc. from the freezer pack. Do not leave the vaccine out of the fridge or insulated bag on clinic day. Contact the CPHO if the vaccine becomes frozen or there's a malfunction in the temperature. Readiness for an emergency. Fainting, breath holding, and anxiety versus anaphylaxis. It's very important that healthcare providers who are administering the vaccine have knowledge of anaphylaxis reaction versus other reactions. Anaphylaxis is very rare, 0.4 to 1.8 cases per million doses given. It is life-threatening but manageable. Ensure that you have an epinephrine kit available on clinic days. And ensure that you chart symptoms and results and fill out an adverse event following immunization form and submit it to the Chief Public Health Office. An anaphylactic reaction may start with a skin rash, itching, and hives, progress to swelling of the lips, tongue, or throat. The individual may develop shortness of breath, trouble breathing, wheezing, which is a whistling sound during breathing. They may become dizzy or faint. Individuals may have stomach pain, vomiting, or diarrhea. And they may verbalize that they feel like something awful is about to happen. Number 3, routine practices, which includes hand hygiene. Performing hand hygiene before and after administration of vaccine, whenever hands are visibly soiled. and use an alcohol-based hand sanitizer with at least 70% alcohol. The use of a biohazard container for sharps is also part of routine practices. Prior to administering vaccine, ensure that you review the product monograph of the vaccine that you're administering and review the NACI statement for 2019-2020 influenza year. Contraindications of any vaccine include a true anaphylactic reaction to a previous dose or any vaccine component, previous Guillain-Barré syndrome within 6 weeks of any immunization, people who have experienced ocular respiratory syndrome with lower respiratory symptoms should have an expert review, those who are currently febrile should return later for their influenza vaccine, and those less than 6 months of age should not receive vaccine. Elements of informed consent specific to immunization are client-centered, voluntary, obtained without fraud or misrepresentation, assesses the capability of the person providing consent, provides standard information and time to ask questions and receive answers, gives the person providing consent the right to refuse or to revoke consent. The individual giving consent must be aware of what vaccine they're receiving, the risks and benefits, the common side effects, and the risks if they do not receive the vaccine. Children under the age of 19 who are able to understand the benefits and possible reactions for each vaccine and the risk of not getting immunized can legally consent or refuse immunizations. Patient assessment includes, is the individual well today? Have they had a previous reaction to this vaccine? Or have they experienced Guillain-Barré syndrome within 6 weeks of any previous immunization? Prior to administration of the vaccine, check the expiry date on either the pre-filled syringe or the multi-dose vial and do a visual inspection of the vaccine, checking to make sure that it's clear and there's no particles. Influenza vaccine is administered intramuscular. For children less than 1 year of age, it's administered in the vastus lateralis muscle, which is located on the anterior lateral aspect of the thigh. The landmark is a hand breadth above the knee to a hand breadth below the greater trochanter of the femur. In width, from the midline of the thigh to the midline of the thigh's outer side, inject into the middle third of the muscle. For those greater than or equal to 1 year of age, vaccine is administered in the deltoid muscle of the upper arm. The landmark is 3 to 4 finger widths below the acromion process in an upside down triangle. Never administer vaccine in the buttock. The QIV and trivalent vaccines are both available in a pre-filled syringe, but the pre-filled syringes will need to have a needle added. The needle gauge and size is dependent on the recipient. 25 gauge for everybody, 7/8 inch for infants and small children, and 1 inch to 1.5 inch length for all others depending on the size of the arm. Some of our QIV vaccine will be available in a multi-dose vial this year due to issues with vaccine supply. For this vaccine, both a syringe and a needle will be required. Observe the recipient 15 to 30 minutes after a vaccine is administered. Common reactions to the influenza vaccine include injection site redness, swelling and pain, fatigue, headache, and myalgia, arthralgia, fever, chills, and malaise. which can occur within 6 to 12 hours and lasting up to 1 to 2 days. Comfort measures may include an anti-inflammatory, an antipyretic, and no SA for children. Serious adverse events are very rare, and they include anaphylaxis, ocular respiratory syndrome, or ORS, and Guillain-Barré syndrome. The risk of GBS with influenza illness, those who have not been immunized, is 17 cases per million, which is much greater than risk estimated at 1.1 million of those who are immunized. Adverse events following immunization, or APHIs, must be filled out and submitted to the Chief Public Health Office within 24 hours of it being reported to a healthcare provider. And this may be hours to days after immunization. The Chief Public Health Office will then investigate and submit a reply back to the immunizer. The immunizer is then to follow up with the patient. PHAC oversees all reporting, and it's part of the post-marketing safety surveillance. It is then determined whether the incident or the event was coincidental or the influenza vaccine caused the event. Local reactions are the most commonly reported event following immunization. A local reaction of pain and/or swelling is only reportable if the onset of swelling is within 48 hours following immunization and extends past the nearest joint, or there's severe pain that interferes with the normal use of limb lasting greater than 4 days, or the reaction requires hospitalization. Reporting of adverse events is reportable under the immunization regulations. Vaccine documentation following immunization includes the vaccine name, lot number, manufacturer, the date the vaccine was given, site, dose, and route of administration, the immunizer's signature and designation, and if there was an adverse event that occurred, a form must be filled out and submitted to CPHO. Where is the vaccine documented? On the organization where they received, on their record, chart or a registry, and the person's record, which would include the date and the vaccine that was administered. All vaccines administered in PEI must be reported to the Chief Public Health Office. This is a requirement under the Public Health Act and regulations. This can be done in several ways, either electronically through the PeopleSoft Employee Health Program, Cerner, DIS, which is a pharmacy program, ISM, or physician billing. Reporting can also be done on paper through an individual paper form or a spreadsheet, which contains the following elements: name, address, date of birth, sex, name of the vaccine, dose administered route, location or name of the clinic office, and the date the vaccine was administered. Instructions of reporting requirements have been sent to workplaces and can also be accessed on the princeedwardisland.ca website under frequently asked questions for influenza. Also, any episode of an adverse event must be reported to the Chief Public Health Office. The following slides are questions or statements that may be asked of you during your influenza clinics. And how would you respond? Should I wait to get vaccinated so that my immunity lasts through the end of the season? Seasonal flu outbreaks can happen as early as October and peak between December and February and can last as late as May. It takes about 2 weeks after vaccination for antibodies to develop that protect against flu virus infection. The beginning of the PEI flu campaign begins October the 15th, and vaccine is available at that time, right through until the end of May of 2020. How would you respond to, I got sick with the flu last year after I got the vaccine? Influenza vaccine does not contain a live virus. It is inactivated and cannot cause illness. One may be incubating an illness at the time of immunization. It takes approximately 2 weeks after receiving the vaccine to mount a response. One reason is that some people can become ill from other respiratory viruses besides flu, such as rhinoviruses, which are associated with the common cold, and can cause symptoms similar to flu, and also spread and cause illness during the flu season. Some people may experience flu-like symptoms despite being vaccinated. They may have been exposed to a flu virus that is very different from the viruses the vaccine is designated to protect against. The ability of a flu vaccine to protect a person depends largely on the match between the viruses selected to make the vaccine and those spreading and causing illness. The flu vaccine only protects against influenza, not other illnesses. How would you respond to, do I need another flu shot this year? I got one last year. Each year there's different strains that circulate, and immunity wanes over a few months. So the vaccine that you received last year is not going to protect you against the circulating strains this year. How would you respond to, I didn't get influenza vaccine last year and I didn't get sick? Influenza affects the population a little bit differently each year. Last year is not a predictor of what may happen this year. How would you respond to, I'm young and healthy and don't need it? Healthy people can become ill. Healthy people can spread influenza, and it reduces the risk of hospitalization and ICU admissions for children and adults. The following are resources for health professionals. And the following are resources for parents and public. Congratulations. You have completed the 2019-2020 influenza module. When you close the presentation, there is a link on the right-hand side of the page in the resource bucket to access the certificate for your records. Thank you. If you have any further questions or you require any further information, please feel free to contact the Chief Public Health Office at 902-368-4996.